Namaste. Today topic is phlebitis, thrombophlebitis. What is thrombophlebitis? In the sense, superficial thrombophlebitis is an inflammation of the vein just below the surface of the skin, which results from a blood clot. This condition may occur after recently using an IV line or after trauma to the vein. What are all the causes for phlebitis? Superficial phlebitis is usually caused by local trauma to vein. So in the sense, when we are inserting a IV cannula, if we make any double puncture, so due to that the phlebitis will happen to the patient. And also superficial phlebitis is most often caused by an intravenous catheter, in the sense IV cannulas, and the vein will become irritated. Like if we give any concentrated IV fluids or in the sense medications, no, due to that chemical induced phlebitis also we may expect. So superficial phlebitis may or not have a blood clot formed to cause the pain and inflammation. So main cause for the phlebitis is blood clot. So catheter in a vein causing redness and inflammation due to the blood clot, and also due to if we use chemicals like concentrated chemicals, due to that also phlebitis will happen. What are all the signs and symptoms of thrombophlebitis? Warmth in the cannula site, tenderness, fever and pain in the affected area, redness and swelling in the insertion site, IV cannula site. So when we see this kind of signs and symptoms, immediately we have to take a action to reduce the phlebitis. So the nursing staff maximum assessing of the cannula for VAP scale is very important. So what is VAP score or VAP scale? In the sense, visual infusion phlebitis score. So when we visualize the cannula site, we should assess the condition of the cannula. So how to assess? There is a scale from 0 to 5, and there is a signs and symptoms also. Based on that we have to score it for VAP scale. So and also based on the score we should take a action. So VAP score 0, the cannula looks healthy, so need not to do any correction for 0 scale. And VAP score 1, during that time the cannula site looks redness and patient may complaining of pain, so staff responsibility is to frequent monitoring of a cannula site for a phlebitis. And VAP scale 2, during that time the cannula site looks pain, erythema, swelling over the site. So immediately the staff should remove the cannula and reset the cannula and apply a ice pack over the swelling site. And VIP scale 3, during the time the cannula site looks pain and swelling, erythema, along with there will be a induration. So during that time also reset the cannula and intimate to the doctor to start the treatment. And VAP scale 4, there will be a pain over the site, redness and induration, along with there will be a palpable venous cord. So during that time also immediately remove the cannula, reset the cannula and apply a thrombophobe ointment. And VIP scale 5, so along with all above symptoms there will be a fever. So patient will be having a fever. So when patient having a fever, consider it is a VAP scale 5. Immediately remove the cannula and intimate to the consultant and start with the antibiotic. So this is the, see, when we look at cannula site, if looks healthy, consider it is a 0 scale. And if a cannula site looks redness, consider it is a VAP 1. So this is a swelling. When a cannula site looks swelling, consider it is a VAP 2. cannula side there will be a induration. So pain, redness, swelling and induration, consider it is a VIP scale 3. There is a palpable venous cord. So along with above all symptoms, palpable venous cord if we see on the side, consider VIP 4, and this is a 5 scale, VIP 5. Along with all the symptoms, pain, redness, swelling, there will be a fever for the patient.